this man's wife was his healthcare agent or healthcare proxy. She said, after a couple of days had passed, she said, you know what? She said to the doctor, what are the chances that my husband is going to be himself again, the way he was before? And he was in the neurological intensive care unit, and the neurologist said, I think that he has about a 30% chance of his completely previous mental status. He'll be the same type of person that he was. About a third of a third chance that will happen. I think there's about a third chance, maybe 33%, that he will get awake. He will be awake and interactive and so forth, but that he will have some degree of deficit in his mental status, not quite the same as before. And there's a third chance that he will have such severe brain damage that he could not be independent or that he will actually die. So about a third of a chance that he will be the same person he always was, a third that he will not be the same but will be up and around, but may have forgetfulness or may have some difficulty with words or may have some mild behavioral changes, and a third chance that he will have severe mental damage or death. The wife said, let him die. Take him off his breathing machine unless you can tell me that his chances of returning to his normal state are almost 100%. I want you to take him off life support. Now, the doctors were a little upset by this, and they felt that there were some serious ethical issues. By law, this lady had the right to make life and death decisions over her husband. He had appointed her to be his healthcare agent. On the other hand, the doctors felt that most people, given those types of odds, would opt for life and hope that they will be in the lucky percentages where they will be back to themselves or with some mild to moderate deficits. I mean, there are people who have strokes. Some of you may know people with strokes who may be paralyzed or who may have difficulty with speech. I mean, they have a life. It's not the same. They can't play ball. They can't climb stairs. But there are other things to their life that gives a meaning. So we were called to do a consult on this case. So on the one hand, you had the law, which says that technically this woman had the right to do this. On the other hand, there were some significant ethical reservations that the doctors had about following what this woman wanted for her husband. And we did an ethics consult, and let me ask you then, you're on the ethics committee, what do you think you would do, or any issues, things that you might want to know? By the way, just to tell you the type of person, this man was a very athletic guy. He was, at the time this happened, he was about 70 years old. He had been an athlete, a professional athlete in his youth, and he apparently, when they got married, he lived kind of a playboy type life. He was liked parties and good things and sports. And a couple of years before this happened, his wife's financial fortunes dropped, and so he had to go out and get a job. He wasn't too happy about that. He also developed some other medical issues, and he had been a little bit depressed, it seemed, prior to this event happening. So, okay, yes, sir.
You know for a fact that some states say that suicide is illegal. So my question is that if this person was alive and up and running and knew that this was going to happen to him, and he was given the chance to decide for himself, is there a law that states that he can't choose to commit suicide?
Let's say this man was awake for this, although it's kind of out of the whole point is that his brain wasn't working. But just for argument's sake, let's say you were outside his body and he said, let me die. Are we allowed as doctors to allow somebody to commit suicide? Now that's a very important question. Off the cuff, I can tell you, all things being equal, no, we don't allow people to commit suicide. However, committing suicide when you have a treatable depression is not the same thing as somebody saying, my life, quality of life, I have metastatic cancer, I'm on a respirator right now, I don't want to continue on this respirator, stop it. We do allow people to say that. We don't consider that the same as committing suicide. If somebody is suffering physically and we cannot help them, they have some terminal disease and they are on life support, we feel that people have the right to say, enough, I want you to take me off the machine. For example, I'll give you an example. Christopher Reeve, Superman, you remember that he was on a respirator, he had a neck fracture and was quadriplegic. Theoretically, if he was on a respirator, I think there were times he was off for short periods, but for argument's sake, if Christopher Reeve had said, and he was totally dependent on the respirator to breathe, if he had said to his wife, dear, I've fought this for 5 years, I've done the best I can, I'm suffering too much now, I don't want to go on like this anymore. Please have the doctors just give me sedation and take me off the machine. I don't want to continue this way. I think the way that would have been handled by the doctors, they would have had to be seen by a psychiatrist to see if there was not a treatable depression, and if it was felt that his request was entirely legitimate in the sense that he was truly suffering and he did not want to go on like this, that he would be allowed to come off the machine. Remember, it's different. We say there's a difference between taking an overdose of pills to kill yourself and rejecting treatment that's keeping you alive. There's a fine line between, that's the difference between physician-assisted suicide in our area, which is the one state where we allow it. If a patient says, I want to kill myself, and usually it's a person with a terminal illness, whatever, they're suffering. In Oregon, the doctor can prescribe a lethal dose of medicine that the patient then has to take. That's why we say physician-assisted, because the doctors don't do it. But there's a difference between doing an action to kill yourself and removing a life support treatment that you no longer want. And in general, our society says you have the right to remove an unwanted treatment that is keeping you alive if you're suffering. So, getting back to this man, it would have been nice to know more. Most people don't think, though, of a situation that will be exactly like this man. I'm sure he didn't anticipate this happening, and we still don't know exactly what happened. Did he get depressed and drunk and hit his head against the wall? Apparently the police didn't think there was foul play of somebody assaulting him. So assuming that this was all either self-inflicted or as a result of a drunken debauch, he didn't think, we don't know for sure what he would have said, except to say that he may have been depressed and did this. But it's not the same, technically speaking, removing life support is not the same as actually doing something to hasten death. Yes?
I was going to say that this is a very hard decision, so it's basically like a yes and no. Like, no would be good, not to remove the
Life support.
Yeah, because there's always a possibility. You never know. There's a possibility that he may live, but there's a possibility that he may die. But also, yes, because he's gonna continue to live in misery. So it's really not good for. And you understand?
Well, when you say he'll continue to live in misery, the doctor felt that there was a 35% or so chance that he would eventually recover completely. So he might be miserable for the first couple of months during rehab and getting better, but eventually the doctors felt that he could be restored to full health. The question really is,